All right, hello guys. Welcome to this live Facebook Live about ABA, Applied Behavioral Therapy. We've talked about this previously a few times already, and the reason why I'm gonna talk about it more is to make clear about my stance about it. And obviously, everyone is entitled to their own opinion, entitled to their own thoughts about a certain way of doing something, right? I'm not gonna say it and tell you that my way is the best way. It's not. There's many ways to do the same thing, and I believe it's the same thing for teaching a child to speak or to be a functional human being in our society. And there's more than one or two ways to do it. And and a huge disclaimer: I'm not saying that anyone, I'm not saying that you are wrong, or whoever is watching this and thinking this man must be out of his mind, talking about ABA, and maybe praising it, maybe not praising it, whatever my opinion is. Okay, so I get that all out of the way. Let's start. Is ABA bad for children, and especially ASD children? Because historically, ABA is a therapeutical method for teaching children on the spectrum. Okay, and if you just search on Google ABA therapy, traumatizing, ABA therapy, PTSD, you will see loads of papers. What are those called? Articles that talk about ABA might not be the best thing for children who are on the spectrum. There are reports saying, a lot of people report that children get PTSD after ABA, right? Parents will report, all I hear is screaming, shouting, and I can't even go in to see what's going on. All right, I will address these things one by one, okay? And the reason why I can do this is because, number one, my first ever job in the therapy world is to do with it is ABA. I was an ABA therapist. All right, I wasn't it's very easy to call yourself a therapist. We've talked about this before in a previous live stream. All right, and the reason why people can just call themselves a therapist, right, is because if you're not in the United States of America, or actually ABA is more of a USA thing, I would believe, right? Then it's easier to self-proclaim yourself as a therapist without the credentials, which is what they call BCBA, a board certified behavioral analyst or something like that. Okay, on top of my head. Yeah, amazed that I can actually remember it. Anyways, so when people say that, I've been to an ABA place, I've worked with ABA clinics that are good. I've worked with ABA clinics that are not so good. All right, and my first point is, you cannot we cannot all say, for instance, if a plumber, let's say it's a plumber, okay, that person who solves my problem, that is very different from solving your child's problems. I understand, but just go with me with this analogy for a little bit. Plumber comes over, he uses a new technique, or a very old school technique. It doesn't matter what technique it is. All right, he fixes your whatever toilet. Okay, he fixes it. Okay, next time you try to call the same plumber, something happened again, you call the same plumber, but he's not available, so you get the next best person. Okay, they come and they use the same method as the first plumber who did an excellent job, and then they screw it up, they make it even worse, so they didn't even solve the problem, they didn't fix anything. All right, is it the problem of the method, or is it the problem of the person who was administrating it? Okay, I don't know. You decide. Okay, what I'm trying to tell you is that just because someone has been to ABA, and that place or that person who is conducting the ABA hasn't done a great job, doesn't mean that the whole approach has no credit, or creates PTSD children, or is super unnaturalistic, or has zero merit towards teaching children on the spectrum, or anyone per se. And ABA is not only used in teaching children who are autistic. Okay, it's not only like that. You can as a matter of fact, ABA is actually used to treat PTSD. Okay, let me just double check that on the internet real quick. Okay, I remember. Okay, if I type ABA therapy PTSD, all I get is how autistic children will get, will get PTSD afterwards. Okay, all right. So that's what I heard before. Okay, because that's what my my supervisor used to give. He got his master's in ABA at whatever it's called. I think it's ABA, master's ABA in the United States. And one of the parts he had to learn was to help with like veterans through the use of ABA. And you might argue, hey, isn't that for like CBD or something? Not CBD. What was that called again? Cognitive behavioral therapy, CBT. Yeah, sorry. Yeah. So those things are like, like obviously CBT is a better way to treat those PTSD people. And I'm saying this as if you know these terms, right? I'm sorry if you don't know. Okay, so let's go back to the main topic of is it bad or not. My main point for the first point is children, people who conduct ABA might not be the best person to do so. Okay, just because someone doesn't know how to do it doesn't mean they represent the whole field. All right, I don't want that to happen. I've certainly seen very bad things in the field of ABA, and they use that name even if they don't have enough training. Okay, so I don't like that. And number two is like ABA is like always, it's like I've talked about this before, right? It's like a behavioral system to teach everything, right? So people would use that thing to teach everything that a child needs to know, and they will step on people's toes, like people like me, like a speech therapist. They're trying to teach speech and language and also communication with their own methods, which I may or may not agree with. And for you as a parent, you may or may not agree as well. Okay, so that's my first point. Second point, how about the PTSD about children on the spectrum who are crying like crazy and they don't get, they just cry like crazy and then you don't know what's happening. All right, so I would like to argue children who are speech delayed, whatever, disordered, they're going to cry anyways if they go to kindergarten, okay? And most of the time, children who start ABA are early because usually what happens is that they go through like early intervention, and the earlier they get into it, the better, right? So think about a child who hasn't even gone to preschool, or maybe they have, suddenly has to go into a highly intensive and structured environment. What are they going to do? Cry, right? So if you think that all children are going to react, to the therapy with a crying attitude, you're probably wrong. Okay, it's around like 60 or 70%, right? So I'm gonna see what questions there are. I think there are two. The first is like Pex from Koyen. Is Pex is encouraged for a 31-month nonverbal kid? I'll talk about that later. I'll get back to you guys later. How soon can a nonverbal ASD go for ABA? Okay, cool. Let's talk about that later. Okay, cool. So I want to talk more and let you guys know about what I feel. All right. So all that crying and stuff, it depends on it goes back to the therapist who is the therapist. If it really, or he or she is really someone who is trained to do that work. All right. They must know how to sell a toy. They must know how to be child friendly. All right. It doesn't matter if it's ABA or not, right? If it's like even a dentist, would you say that being a dentist would cause a PTSD? Would you say that being a hair salon barber, the children's barber, is that causing PTSD? Yeah, to some extent, right? But were they they're doing the job, but were they trained to work with kids? Have you seen really child-friendly doctors and dentists, nurses, barbers, whatever? You have, right? It's the person. It's how they conduct themselves professionally, and do they know how to work with children? That's the point I'm talking to you about, right? And why? One of the things that I learned recently is that I was working with someone's ABA therapist, and I feel like there is a very dehumanizing point of view towards ASD people or children in general, and they don't know how to treat that ASD children or person as a real human being. I feel like that's a problem sometimes. I feel like if this was just a typical developing kid, you wouldn't think that way. You wouldn't say that. You wouldn't try that. You wouldn't, do whatever you're doing. I'm not going to go into details because that's my client's information, right? So let's talk about let's go back to the question. So Kuyen, I think, sorry, is PECS encouraged for 31? Well, I have talked about PECS before. Maybe I'll make next week I'll talk about PECS in particular. But to be honest, people always think, oh, if someone's nonverbal, we should try PECS, we should try AAC. Yes, we should. And the reasoning sometimes is kind of wrong. Okay, so PECS, you really have to go. If someone has to conduct PECS, most ideally is someone who has been through the PECS course, or working with someone who has been through the PECS course. Okay, I haven't been through the PECS course because there just wasn't any PECS course at the moment that when I graduated until now that was particularly convenient for me to join, right? But I have worked directly with someone who is PECS certified, and they write the whole plan, and they teach me how to do it, right? So I've done that before. I'm telling you that PECS, all right, you need to see if that person knows how to do it. Number one, again, it's not about the horse, it's about the jockey, right? If you don't understand this analogy, it's like, in a horse race, it's a huge thing about the horse. The vehicle is a huge thing, but the person driving it is also very important, like a huge plane, it's automated. You just need to press a button, apparently, right? And then they fly, but the pilot is also very important, right? So PECS, is it a 31-month nonverbal kid? Is that encouraged? It depends on if your child has any want to initiate communication. Okay, PECS is more about teaching a child to initiate communication. All right. So just the first two stages of PECS is all about stuffing a card into a child's and into the adult's hand. All right. PECS, for those who don't know, is Picture Exchange Communication System. Yes, I got it right. Okay. So you got to know if they have the initiation to tell you or not. Usually we use PECS for children who lack the initiation, don't like the conventional ways of, tapping, using gestures, eye contact, like vocalizing. These are all out of the question. We will use PECS to teach them how to start a conversation correctly. And that usually means them initiating without us even trying to encourage them to, which is a huge problem in the therapy industry, is where a lot of children are prompt dependent. I was talking to this mother the other day. The therapist told her to teach the kid by showing, letting the child lead them by the hand, and then the mom will ask, oh, what do you want? And then say, I want cookie. It becomes a whole sequence, and then the kid remembers that and never says it themselves. So in this instant, PECS would be a good idea because it changes the story, and PECS is great at teaching a child how to initiate communication with cards, right? So how soon should a nonverbal ASD child go for therapy? Go for assessment, see what they say, all right? See what the psychologist says, see what the therapist is saying, and then try it, okay? Try it for a month or two. Okay, how soon? I would say the earliest you really can go is around 2.5, I think, because if there are two, they can't even sit properly for a long time. And ABA is 3 hours a day and 5 days a week. If your child, young children, you might think, oh, me sitting here requires no muscles. But for children, their abdominal muscles, their whole muscles, the structure, they just cannot really sit properly. They get tired, and that's why they have to crawl around and roll around and stuff, right? And sometimes even run, But, you get my point. How early should you start, preschool, kindergarten, whatever, or play group, or, speech therapy? I think it largely depends on how long your child can sit, what the therapy is like, what the activity is like. If it's all sitting like ABA, I would say at least 2.5. So Yubing says, oh, by the way, Yubing, I remember you're in Yabing, or is it Wai Bing? I don't know which one. Sorry. Please let me know how to pronounce your name, because I always see you around, and I really want to be able to like call you in the correct way. So remember, on Thursday we're having a membership call with the videos. If you haven't, you can submit the videos to me. Okay. So I was a BA in psychology. Okay, but would I say that I was qualified? No, I had to go through, like, the place that I worked in. They provided 2 months of training before I started. Actually, a month of training before I started, right? And they told me about what to do. They supervised me a lot. And the most important thing is that the supervisors are great in ABA, okay? Because it really helped me a lot, and it helped the kid a lot, okay? If it wasn't for the supervisors, I wouldn't know what to do. You know, I'm just a guy who just graduated from college back then, okay? So having a BA in psychology has nothing to do with ABA, nothing, zero, okay? And to be honest, you know, the BAs in psychology might know the theories behind it, but practically, when you do everything, are you able to name all the theories and stuff? Are you able to link it back? No, and it doesn't matter either. It's all about the results, right? So Korean says, how to understand nonverbal kid and deal with emotional breakdown. Dude, there's always, sorry for calling you dude, ma'am, okay? There's always a reason behind emotional breakdown. And I've talked about that in a previous video, so I'm not gonna repeat myself there, all right? If you haven't, you should join the courses in Agents of Speech. Start with the micro course, as listed in the title or something around here, okay? Cool. So after answering some of your questions, I wanna keep on talking about whether it's good or bad. I really think so. I really think it's not bad at all, okay? You cannot call, you can't even say that, you know, anything is, you know, is bad in nature. You know, back in the day when ABA was like, or not just ABA, special needs education was really based upon behavioral psychology, right? And this is what ABA is. It's based on behavioral psychology. Is what we teach, how we teach like animals per se. Like I've got like 2 cats here. So, you know, it's how you condition them. And whether you want to believe it or not, these behavioral principles are true in human beings, even if you don't want to believe it, all right? And then some people will say, oh yeah, you treat children like animals. Well, you know, I don't know what to say other than, is there a better way, a more effective way to get to them, right? In the beginning, really? If there is, then, you know, by all means, there wouldn't be ABA, right? There would be something else, okay? And a lot of the things we use are from the same guiding principles, okay? And back in the day in 1970 something, when we were first teaching autistic children, why they had like, you know, we're not doing this anymore. I'm saying this again. No one is doing this anymore. There was like strict no's, right? Like very loud no's, like no, like that to kids, scolding them. Number 2, there's punishment, you know, not saying like hitting or whatever, but, you know, starving them until they want the rewards. I'm not talking about now, okay? This is 1970 or 1980, okay? Or probably 1970 something, right? So, you know, all these techniques that are like slightly like treating like children like animals and pets and whatever, it's not here anymore, okay? Now ABA is much more naturalistic, okay? Actually, sometimes if the person knows how to do it, it looks like they're not doing therapy, okay? It really is like that. It's like they're just playing, okay, with a lot of talking, right? So there's a huge misconception about it, okay? Number 2 is that the people who are conducting it are not well trained. They don't know what they're doing. And I'm not saying this because to step on them or whatever. I'm not saying that as a, you know, as a fellow practitioner. I'm like saying they're not good. I'm good. I'm not saying that. I'm not great at ABA either. I'm not even in that field, man. I'm just telling you from what I'm looking at, what I'm seeing. Okay. And if you ask me, what we should do here is that The problem is that ABA is expensive, okay? And the reason behind it is it's skilled labor, right? You take someone fresh out of college, fresh out of university, sometimes not even university grad, right? To do this kind of work, experience is rather, in this field is very, very, we put a huge emphasis on it, right? Like a mom figure who has been working in the field for like 20 plus years would have a lot more authority in front of the parent or in front of the kid than someone like me, right? No, I'm just a regular Asian dude who's like 30, right? So, like people will think that way, right? And the kid you can also see in the kid that they're like scared of that woman, So, and the problem is that here is it's not about the experience, it's about how you do the skills. Like, how do you transfer those skills to the parent? Number one, how do you use those skills to teach the kid? All right, these things you cannot see. All right, you really cannot see, and you can only see it by the progress and results of the kid. Okay, so my advice here is there's no bad therapy by nature. Who in the world would go into this kind of business? Okay, the money isn't that great, right? Like, who in the world would make like an evil type of method to teach children who are on the spectrum for earning less than just working at the bank? Come on, think about it. Like, why would we even do it? It's not even financially rewarding. You think about it, like, to everyone, like I'm just saying out there, to everyone who says ABA sucks, ABA whatever, like, if you can find a better way, like, okay, let's talk about like floor time or whatever, right? And naturalistic approaches, they have their own place. Obviously, we have to use it too. But if you say that, 100% floor time, I wonder how much you're gonna get done within an hour. How much words are you gonna teach within that hour? How much communication interactions are you gonna be able to elicit, right? That's what I'm talking about, okay? So Ku Yen says, how to encourage you to follow a song rhythm, do the actions, tend to focus if you're interested in the song, but only listen. I should show him wonder why. Okay. Hey, are you inside of the micro course, Ku Yen? So Kui Yen, sorry. So you should really join, because it really isn't about if he's doing the actions or not. It really 100% is about if he's interested or not. You need to know why he's not communicating with you, why he's not whatever or anything. You should think about it in that way. Always have something to offer to your kid. If it doesn't interest your child, they're not going to talk to you. All right. It's very different from typically developing children, right? Typically developing children do anything and they kind of laugh. But for children who are delayed, like disordered, whatever you call it, I don't want to put labels here, left and there. But if your child isn't talking yet, most probably is because it's too hard or it's not entertaining, right? It's either the two. So you better make it easy for those two reasons. All right. Am I providing ABA short course for parents? No, this is not ABA or anything, or I don't even call it speech therapy. It's just what's been working from me teaching offline to parents like you, or all over the internet. I've been teaching not children. I wish I could teach children over the internet easily through Zoom or whatever. It doesn't work, man. Like, they look at the screen and run away. What am I gonna do? Like, extend electronic hands and hold them or something? Impossible. So we have online courses for parents. The first one you should take is the micro course. Just go to agentsofspeech.com/micro. We've got over 1,000 people inside already. So join if you want to. All right. And then, these kind of questions that you ask, it's just, I've heard it 1,000 times. So go check it out there and watch it, and then ask specifically for a child inside of our Facebook group. And then it'll be much easier to help you. All right. So all in all, let's wrap up this live video. I've been talking too much. Obviously, my stance is that, ABA isn't bad. It's in fact, I like it. It's good. How about when I ask the children who are on the spectrum, who are now teenagers or adults within my circle, the people who I taught, who I am teaching, what do they say about ABA? They like it. They like the structure. They've never heard. And I said, do you feel bad? Like, do you have bad memories about ABA? And then they said, no. In fact, they didn't have bad memories about ABA. They had bad memories about like sensory integration, speech therapy. They had bad, memories about like their parents bringing them to what's that called? Acupuncture in the head. Those are the bad stuff, right? And I would say that, and I asked, hey, is it really like speech therapy got you a bad experience? And then my student told me that it was that teacher back then that really scared her, or him. I forgot which one. Okay. So see, it's not the thing. It's not the therapy. It's not the method. It's the person conducting the thing, the method, the whatever. All right. You can there's a whole spectrum. I'm saying spectrum of skills, abilities, competencies, whatever. Okay. Across any profession. You can have a waiter that is real bad, but you can also have a waiter that's like very good and you feel so good and you want to tip him $100 or something, right? Agnes, I have no idea. Right? I really do not know. I am not a healthcare professional. I do not provide this kind of advice. I would say that after a child has been to acupuncture and has come to me, first of all, they're really tired. Because why? Everyone has to pull him down in order for the needles to go inside the head. They're damn tired because there's a bunch of adults holding them down, right? Second of all, I would argue that they are a little calmer than usual. I don't know if they're tired or I don't know, or they're more zen or whatever. But yeah, I think that I really don't know. In terms of mood or whatever, I think it's effective. But I'm telling you again, guys, whatever medical or biomedical or like acupuncture, whatever, massage or whatever, these kind of stuff, hey, you practice what you get. And this is where like ABA is good because they only focus on the observable skills, all right? You acupuncture someone and you don't teach them how to talk, they still, no matter how smart they become, they still can't talk. You know what I'm saying? It's not something that without the lack of practice, it will come naturally. It's not like that. If it were like that, they wouldn't need speech therapy. They wouldn't need ABA. They wouldn't need like occupational therapy, that kind of stuff. Remember, you practice what you get. You cannot just say, oh, after they ate like some DHA stuff and then they start talking, right? It never is like that, I think. All right. If there's someone who tells you, oh, it's all because of biomedical, I think there's something fishy going on. Okay. Coming from a therapist. Okay. So I'm really biased. Okay. So yeah. So obviously there are some people saying out there like, oh, I take this medicine, just help my son a lot, help my student a lot, eating this, playing this, whatever, increasing their cognitive ability, whatever. I don't know. I really don't know. I only know that. This is what I know only. Okay. Before I say that, yeah, simple neurofeedback, not offer. It's not about helping. It will help in a way, but it won't help for what you're looking for. It won't help. It might like help their gut, it might help their, their overall calmness, but will it help their speech and language? I don't know. Right. It's like, for instance, your joints. For me, for my joints, I eat like fish oil, DHA, EPA, right? But does that mean I'm going to be able to be more flexible just by eating fish oil? No. Does that mean my joints are going to be stronger because I eat that kind of stuff? No. It helps, but it's not going to help me become the thing without the practice. That's the thing I'm trying to say, all right? Obviously, all this kind of stuff works for everyone. But you cannot say because I ate this thing or because I did this and it led to a result that is totally not that related. All right. If you say that I went to speech therapy and my speech became better, I think, yeah, fair enough. Right. If you went to like occupational therapy and now my son can grip, the pencil nicely, then I think, yeah, okay, fair enough. Right. So, but if you say that, oh, my son went to acupuncture, now he can talk, I don't think so. Right. So, obviously, it will help with, like in a different way. And I'm going to end with all I know is that to those parents who have reached out to me like through email, through private message, those who posted in the group, who like have seen results in helping their child to speak, right? There's only one common thing. Students say who are on the spectrum tell me they wouldn't be able to communicate at all if the mom, especially the mom, usually pulled them out, when they ran away, put them back on the seat and kept on practicing. Okay, no matter whatever method you want to use, right? ABA, speech therapy, floor time, PECs, whatever. I don't care. All right. Parent involvement is very critical, and it's up to you. Okay, whether the methods that I talk about here will work for you or not, they will only work if you put time into it. They will only work if you take action upon it. They will only work if you practice the thing that they need to know, right? If you're teaching them to like crawl, then how is that? What's that to do with them talking, right? Yes, and consistency. That's correct. And it takes a lot, because I know you guys are very tired and stuff. And this is, it's a full-time 24/7 job. Okay. But I just want to tell you guys that, that's what I've been hearing from everyone, like from adults who have suffered from speech disorders. You can check him out. He's on Facebook. He's called Jordan. I think it's like Fighting for My Voice. It's a Facebook page of a guy right now who's 20 something or something. And then he only started talking at like 5 or 6, his first words. He's got apraxia of speech. And then he said he wouldn't have done anything if it wasn't for the mom drilling him after speech therapy, right? And there's also another kid who's in Indonesia who's I'm teaching right now. He's in primary school. And he said if it wasn't for ABA and then his mom doing ABA with him, he wouldn't have been able to. And he even wrote a book, man, although he doesn't speak that well still right now. But he does write it out and stuff. And he says that, like ABA therapy is great. He likes it. He likes the teacher who taught him. And I'm just here to say, it's not the method. Find someone who you can trust and trust 100%. It might not be me. Don't need to be me. I don't want, maybe, I don't really want that. Sometimes a lot of pressure, right? But at the same time, go try it. Do it and evaluate if it's effective for a kid or not. Same for all those like essential oils, whatever, like biomedical stuff. Just because it works for one person doesn't work for you. But all I know is that you practice what you get, right? You try as much as you can, right? You can only, if you're teaching a behavior, which talking, communicating, language, these are all behaviors, then behavioral therapy is worth it. Okay? And that's all I wanted to talk about today. And thanks everyone for checking this video out. You're very welcome to those who are saying thank you. I really appreciate it. And if you haven't, you should really join agentsofspeech.com/micro. It's a low-cost online course for parents, just to go through all the frequently asked questions, like for instance, how to get your child to sit down, how to get them to look at you, how to get them to answer to your name, to their name, how to make them want to talk to you. What things are you doing that you shouldn't be doing, like asking questions, whatnot, that kind of stuff. You can go there and check it out, watch it, and then, use it into your life, right? And a lot of parents are saying that, not really a lot, but around like 20 plus are saying that they're seeing great results. And you can see it inside of the website. And just go agentsofspeech.com/micro, check it out. Go look at what parents are saying. Join our private Facebook group for that one and ask there. And we can go from there. Okay. So that's all for today. Thank you. For those who are inside of the micro course already, we have our monthly Q&A on coming Wednesday. So check that out. And it will be probably like in this format. And you can ask me anything you want there. Okay. So see you guys. Thanks. And have a great night and stay safe.